Good afternoon. I'm Carmel Angelo, Mendocino County CEO, and today is our weekly Friday COVID update. And today we have Dr. Doohan with us here in Mendocino County, and at this point I will turn it over to Dr. Doohan.
Hello, Mendocino County. It's so great to be here, back in this county that I love so much. Speaking to you from Chambers at in our admin building on Low Gap. So that's where we are physically. I do want to cover three topics today: testing, an update on our cases, and the health order and attestation process. So regarding testing, let me move this chair. There's been quite a lot of news this week. One of the things I want to start out with is the false positives that we had. And I want to clarify what these false positives are about. They are specifically related to one PCR machine. That's a molecular diagnostic machine called the Abbott ID Now. And this is a machine that is called a point of care COVID testing machine because it gives results very quickly. So individuals can go into a hospital or clinic and have a swab performed and get that result within less than an hour. But what is the case about these Abbott ID Now machines is that they only should be used on symptomatic people. So if somebody's asymptomatic, they don't feel sick, and they're being screened, like what we do for surveillance, the Abbott ID Now is not recommended for that purpose. However, it is being used across the state for surveillance purposes. For example, for pre-op screening, when someone comes in to have a surgery who's not sick and there's the desire to see if they might have COVID. So it was widely shared by the state that the Abbott ID Now should not be used for asymptomatic people because it could produce false negatives. And so this was something I talked a lot about in public and within our EOC and DOC and Public Health Department internally, that an asymptomatic person who got a negative result on the Abbott ID Now, that was not a result that we could be sure of. And for that reason, for example, when we had the outbreak in Round Valley where the Abbott ID Now was used, the clinicians in that Round Valley clinic, who are excellent clinicians, tested the people who came in with the Abbott and repeated the tests by sending them off to the commercial lab Quest to verify. So while that in Covelo, in Round Valley, we did have some testing done on the Abbott ID Now, all of that was verified by the state at the Richmond Public Health Lab. And so we knew that we could actually believe those initial results. But after that time, we did get two positives reported to our county that had been performed on Abbott ID Nows. And so those were posted on our tracker and reported as positive cases. And one of those that got quite a bit of attention in the media because it was a high-profile case was a nurse in Fort Bragg. But on the very day that the positive result was obtained on the Abbott ID Now, through the Adventist Health System, they repeated the test by swabbing and sending it to the BD Max machine. That's B like boy, D like dog, Max machine that's at Ukiah Hospital. That machine is a real-time RT-PCR machine, which is where it is has high sensitivity and specificity, and in particular, very high specificity. So a positive result from that BD Max machine is absolutely believable, as are negatives. So in the case of these false positives, they were repeated by testing at the Ukiah Hospital, and we also sent a verification off to the state. And these, because of this process that we went through, we were able to prove that those were false positives. In other words, the Abbott ID Now gave a positive test, but when we repeated it, the BD Max machine and the real-time RT-PCR machines showed negatives. And we discussed those cases with the state, and the state concurred that these were false positives. So I want the public to go away with this message that if it is an Abbott ID Now machine that is doing the testing, and you would know it because it would be a rapid test available in less than an hour, and you would get the test right there in the hospital or clinic. If you're not symptomatic, that is not the appropriate machine to use to test you for COVID. So otherwise, the other machines that we use, like the BD Max machine that we have at the Ukiah Hospital, or the state lab machine in Richmond, or the public health lab in Sonoma County, or Quest Laboratories, these are real-time RT-PCR machines. Those positives are absolutely believable, that these machines have high specificity, and the negatives are believable on these. So I don't want people to hear that we had false positives and think that that means that all of the positives and all of the negatives that we have are not believable. That is not the case. It's only specifically for the Abbott ID Now, which is a rapid testing machine that's only meant to be used for symptomatic people. The other thing I wish to discuss is that there was some confusion because we had 30 cases, and then we subtracted the 2 false positives, which dropped us down to 28. And then we had 5 positives come through OptumServe. Now, OptumServe, that was on Monday. OptumServe uses Quest to do the testing. So the samples are collected by OptumServe, which we have in our fairgrounds, and then they're sent off to Quest Labs, which is in San Juan Capistrano, which has the real-time RT-PCR machine. So those are absolutely believable, reliable results. And we got 5 positives out of our OptumServe testing that came back on Monday. So this was another point where we had some challenges that I want to share with the public what occurred. OptumServe it's a treasure for our county. It comes from the state. It's a resource that jurisdictions around the state of California have received. It was very difficult to get this resource. We had to do a great deal of advocacy. You might remember Carmel Angelo's call to action. Carmel Angelo and I were on many, many calls with leadership from the state late into the evening, on the weekends, to get this resource for us. It's a resource that comes from the state. It's paid for by the state. And for individuals who use this resource, it's free, although you do need to give your insurance information, which doesn't mean you're charged, but it's a way that the resource is tracked and that the state might get reimbursement from the insurance companies. So as it's a new resource and a very complex resource because it's deployed all across the state, our initial testing that we did, we had a challenge with the reporting. Not the reporting to the individuals who were tested, but the reporting to us in the county. So what happened is that we had 5 individuals test positive in our first round of testing through OptumServe. And those individuals did get the results that they were positive, and they were told to be in isolation and that the county would contact them. There was a delay of a day before the county received the information from OptumServe that we had new cases. So we had a 24-hour delay where the individuals were informed that they were positive, but the county didn't have that information yet. But we have corrected that delay, and that should not happen again. I can tell you that on my many conversations with health officers across the state who have OptumServe, it's considered an extraordinarily positive resource, and none of these other jurisdictions had been reporting a problem with reporting to the health department. So I think we encountered a little bump in the road that we got over quickly, and none of those individuals who were reported positive had any break in their isolation. They remained in isolation, and in fact, 4 of them were actually individuals that were close contacts with a known cases, so they were already in quarantine. And the other was somebody that, from the history of our case investigation contact tracing, it does look like this was an old infection, but for abundance of caution, this individual's isolating just like any other person who has a new diagnosis. So none of these cases were hospitalized. All of them were tested through OptumServe, and they all went into isolation or quarantine in a prompt fashion, and they're doing well at home, and we monitor them daily. So we have 3 types of testing that we do in our county, and in fact all across the country. These are the 3 types. We have people that are sick, and for people that are sick, they go to their clinic or to a hospital, they call ahead hopefully, and they can be tested. This is going on and has never stopped in our counties. We have fantastic clinic system out in our communities all across our county. We have hospitals, and individuals are going in as needed and being tested, and that continues to be a way for people to get testing. We call this commercial testing. For example, if someone were to go into the MCHC clinic in Ukiah, and they went in and they had symptoms and their clinician evaluated them, that test would be sent off to a commercial lab just in a standard way that other tests are sent off. So that is ongoing and has never stopped. The other way that we do testing is what public health leads. When we do our containment strategies, we find a case, we do case investigation contact tracing, we provide isolation and quarantine housing, and then we offer testing to the contacts of that individual so that we can make sure that we are looking for new cases and that we contain that outbreak. That activity the Public Health Department has been doing all along, and we are continuing to do that. And that is a major focus of our efforts in the Public Health Department, is containment of outbreaks. We have contained every outbreak that we've had. That is evident by the numbers of cases, active cases that we have now, which are actually right now we have 9 in isolation, we have 16 in quarantine, and 1 in the hospital. And we have a total of 33 cases with the 5 new ones from OptumServe. So this outbreak containment testing, where it involves isolation and quarantine, we do this testing in partnership with our public health labs. So in this case, the Public Health Department, we would send our team, we would obtain samples, and those would go to the Sonoma lab for processing or the Richmond State lab for processing. The third category is surveillance testing. And here in Mendocino County, we have been very successful with our surveillance testing programs. This has been done in partnership with our clinics and with the cities and different leadership across our county, and it's been a great partnership that we've had to do the amount of surveillance testing that we've done. So we monitor the surveillance testing. We have a very beautiful spreadsheet I'm looking at right here. Our very first surveillance testing happened on April 7th, 2020. This was initiated because there was an individual that came into the emergency department at Adventist Hospital. I got a 3 a.m. text from one of the ER doctors, and then right in the morning I turned to our team and I said, we need to immediately start doing surveillance testing. And that was the very first testing that we did. It was the earliest we could do it because before that time we didn't have the swabs, for example. We didn't have our teams prepared to go out and do this type of testing. But we did at that point. So that testing was done at Plowshares, and it was initiated because the individual that was of concern in the emergency department we thought might have COVID, and that individual was tested, came back negative, and we did the surveillance testing at Plowshares, and everyone came back negative. So that was very reassuring and was our very first surveillance testing. The last one we did was on May 26th, and in this period of time, we have between April 7th and May 26th, we've tested at skilled nursing facilities, assisted livings in Fort Bragg and Covelo and Wallala and Anderson Valley and Redwood Valley, Willett, Slaytonville, and Ukiah. All of this has been partnerships, and this has gone very, very well. And the number of surveillance tests that we've done, I'm just looking on my list here, is a total of 3,043 tests. And out of that, surveillance testing, that actually includes OptumServe here in this total. So out of that surveillance testing, we have had 8 positive tests. But out of the surveillance testing that wasn't done in OptumServe, we only had 1 positive test in our county, and this was actually an individual we already knew about because had been in quarantine with their spouse who was a known COVID case and never developed symptoms. And they remained in quarantine and then rolled over into isolation, and never exposed anybody else. But that was like a known individual for us, a presumed positive. The other case that was positive out of the surveillance that was not OptumServe was someone from another county, from Sacramento County. So out of all the surveillance we've done, not talking about OptumServe, we've only had 1 case in our county. But from OptumServe, within the first weeks that we've had it, we came up with 5 new cases. So we believe OptumServe is incredibly valuable. And my messaging to you today is going to be, please make appointments to get surveillance testing at OptumServe. For people that live outside of the Ukiah Valley, if you come for shopping, if you come for medical appointments, if you come to Ukiah for any reason, maybe you're coming for a worship service. There's many reasons why people come to our Ukiah Valley. Please make an appointment and be tested at OptumServe. Regarding testing at our outlying areas, some of our frontier areas, are parts of our county that we care about so much, but that are not in our Ukiah Valley, we are working on developing a process so that we can collect samples at outlying areas and bring them to the OptumServe. But to do that, we need to meet the baseline requirements of OptumServe in terms of volume in the Ukiah Valley, and that's 132 tests per day. So we need to get that volume done in Ukiah Valley before we can expand. It's called creating a second lane. And when we expand, we'll be able to do this expanded surveillance to our outlying areas. The good news is that in our outlying areas, we're not seeing evidence of community spread of COVID, with the exception of some of our North County areas where we have continued to have surveillance. And I'm specifically speaking about Covelo. So I want to hope that all of us will believe in the worth of OptumServe and not be scared off by the false positives that we had, not to be scared off by that initial challenge we had in reporting from OptumServe, but to understand that this is an incredibly valuable resource that we could lose if we don't use it. So please, schedule your appointments. We also have a requirement with our skilled nursing facilities and our assisted livings to regularly do surveillance there. And with that surveillance, we are using our OptumServe resource as well as for our first responders. So this is a requirement for our attestation process that we do continued surveillance on our first responders and in our skilled nursing facilities and assisted livings, because these are very high-risk locations. So I did discuss the cases with you. We have 33 cases, 9 are in isolation, 1 is in the hospital, 16 close contacts are quarantined. This is a very good number for us in Mendocino County, 33 cases. This shows a slow rate of spread. It shows that we're containing all outbreaks, and we've only had 4 people in the hospital total. 1 remains hospitalized. Nobody has died, thank goodness. So we are in a very good position right now in Mendocino County. So regarding the health officer orders and attestation, there are orders. I do encourage everybody to go on our county website and look at our orders. We have orders for facial coverings in public. I wore a facial covering into this building, but when I sat down here, I'm far away from anyone else in the room, and I'm not sick. I have been symptom checking. I've never been sick through this pandemic, so that's why my facial covering is off. But there is a facial covering in public order. There is a medical masking order for medical environments. There are multiple sheltering in place orders with the red line versions up as well. There's blanket isolation and quarantine orders, which mean that if somebody has a test positive for COVID, that their close contacts need to be in quarantine and they need to be in isolation. Regarding the sheltering in place orders, I have said, I've made the promise to Mendocino County that as long as our numbers remain good, that we're slowing the spread and flattening the curve, which we are, I will continue to steadily open up as much as the governor allows. Well, this process of opening up is quite complicated. It's not just a matter of me writing a new order. It's hours and hours of preparation and work. And that preparation and work also includes many phone calls with the state where I'm listening, participating with other health leaders, other health officers across the state, with health officers from the Bay Area, for health officers from Northern California rural regions, and with other state leadership. I'm listening and participating in these calls to anticipate what's coming next. That's the first step. The next step is to meet with our attestation team here at the county, where we track data and we provide resources to the state to show that we can safely reopen. And the other part is meeting with county council, where we go over line by line, every line of every order to make sure that it is enforceable, that it is advisable, and that it is in the best interest of the public's health. So last week, I called an emergency meeting of our team, and I said, we need to start preparing to open up. What I'm hearing is that there's going to be some opening up coming from the governor. But of course, I didn't know yet what it would be, but we started having meetings with what I anticipated it would be. And I'm very glad to share that my anticipation was right on track, because this morning we had a meeting with leadership from the state, Secretary Gali, Susan Finelli, and Sonia Angel, our state health office, our director of public health from the state, Dr. Angel, and they were sharing with us what is going to be allowed to be opened up next. So we're waiting. It should be posted anytime at the state, on the state California Department of Public Health website, what could be possible to open up. And I will share that it is in the areas around lodging, campsites, gyms, wineries, family entertainment centers, and some other areas around schools, day camps, and daycare. We're waiting for that guidance to come out, but while we're waiting, we're hard at work. I'm hard at work with county council, with our attestation team, and then also I'm so grateful for the ad hoc Board of Supervisors, Supervisors Jurdy and Williams and the West Company, who are working with the business community to be ready as we have our further openings. So we're working behind the scenes, getting ready, and on Monday, we will be announcing, let me say on Tuesday, here in Chambers, we'll be announcing more specifics about what will be opening up. But again, we're waiting for the guidance from the state. So I will share with you that we are not ready to open up for tourism in general ways. This would be very dangerous for our county right now. Not only because there has been reopening across our state, we had a lot of travel on Memorial Day weekend. We also are having largely peaceful, but some not peaceful protests across the state, and we do expect to see surge occurring. And in fact, we are hearing from our neighboring counties that it is occurring. So to have widespread open tourism right now would be very concerning. So as we do open up into this next phase, there will be limitations on tourism. So I will be coming out with new orders following this next round of attestation, and those orders will be coming out on June 12th. And I will be sharing what I anticipate in front of the Board of Supervisors on Tuesday of next week. So I believe that's it for a good summary. I want to thank you all, Mendocino County. It's just tremendous what we've done in our county. We've kept our numbers low, 33. We've had no deaths. We have not had any surge that's overwhelmed our healthcare system. We've had great collaboration with our business community, with our healthcare system, with our city leadership, with our public safety, with our sheriff. I'm so appreciative of our sheriff. He's been a fantastic partner as we've moved through these very difficult times. And I have a long list of thank yous to our partners in our county, that we've done such a good job to stay safe. And ultimately, it's you, every single one of you, every single person who lives in this county has been doing the best that they can to keep us safe. So thank you, Mendocino County. I'm so happy to be here. And I will turn it over to Sarah.
And this is Carmel Angelo again. Before it goes to Sarah, I would personally like to thank Dr. Doohan on behalf of Mendocino County for all the work that she has done under the direction of the Board of Supervisors and with our team in the Department Operations Center and in Public Health. So thank you. Additionally, I would like to say that this past week, some of us on the team did go to OptumServe at the fairgrounds and get tested. And for those of you that haven't gotten tested yet and have some concerns and have heard horror stories about the Q-tip, I will tell you it's very, very small. And it's a 3-second test. And you literally walk in, give them your name, and you're tested. And you could be in and out of the fairgrounds within 10 minutes. They're very quick, very efficient, and it is painless. So thank you again to the public, as Dr. Doohan said, for all of your great support and your participation in keeping yourselves and your families, your friends, and the whole county safe. So thank you. At this point, I'll turn it over to Sarah Duquette.
So for questions from the media, we have Willits Weekly up first with Mike Adair.
Hi, Dr. Doohan, a couple questions for you. I wanted, let's see, there's a report that you're going to be working largely, I would say, greatly reduced hours in the very near future. I've heard that you'll be working between 10 and 15 hours a week for Mendocino County. Is that true? My first question.
Thank you, Mike. That's a great question, an important question. So I have not had a day off since mid-January, and that's true. But what that's allowed me to do, I've been involved in this pandemic response from the very beginning. So I've been tracking and involved in this rapidly evolving event from, I remember, in early, even before January 15th, being on calls with the state that this virus was breaking out in China. Because of that, I have in my brain, all at once, the history and the knowledge and the information that's accumulated after all of these months of working up to 90-hour weeks. I finally got it down to 70-hour weeks. And but this week, I pledged that I would get it to 15-hour weeks. And we're doing a great job. And the reason is to keeping me to 15 hours, starting this week. The reason we're able to do that is the team. We're working so well together now. We have Becky Emery as our DOC manager, and we have just an outstanding team. So I am able to hand over a lot of the daily duties that I was doing myself, the phone calls that I was on, the different meetings that we have with our different partners, to others on our team, including Dr. Flaherty, who's been our deputy health officer. And because of this, we have a level of efficiency now where it's being successful. So I'm limiting now my work to interactions with our CEO and Incident Commander Carmel Angelo, Becky Emery, our DOC manager, with our PIO, Sarah Duquette, and our Deputy Health Officer, Dr. Flaherty, and focusing on these, interactions, and then of course a lot with County Council and our attestation team. And beyond that, they are doing a very efficient job of giving me the information I need so that I can make the decisions that are the needed decisions. And then of course there's other phone calls that I'm on, with the state, where with our health officer community and with our state leaders. So I have actually, as of now, gotten it down to that number of hours, and we continue to look for a full-time health officer to step into this role. When we do find a full-time health officer, I will be glad to give my expertise to that individual. As of now, there has not been an applicant at this, for this full-time health officer job that is being considered, that I'm aware of. But we're waiting for a local person to submit an application. We hope to see such a full-time application come forward. And in the meantime, I'm the health officer, because it is statute that you must have one health officer, and that health officer must not have any conflict of interests. And I have neither a conflict of interest, and I am one person, and I'm your health officer for now. So thank you.
Okay. I would say I don't have any more questions. Thank you so much.
Thank you. We are now bringing on Adrian Bowman with Mendo Voice.
Sarah, thanks for answering, or thanks for calling me in here. I didn't, once again, I was cut off from Mike's last question, so I apologize if this is redundant. But I just wanted to clarify what happened with the nurse. You were referring to the traveling nurse earlier when you were talking about the false positive. Is that correct, Dr. Doohan?
I was wondering, no, it's not a traveling nurse. It's a nurse from Fort Bragg.
So this is a different case from the nurse in Fort Bragg, the nurse who was working in Fort Bragg, who was the traveling nurse.
About a month ago, the nurse lives in Oregon.
Okay, so that was a different nurse. Okay. I'm wondering,
I think we lost you, Adrian.
Can you hear us? Can you hear us,
can you
Adrian?
hear me?
Yes. Can you repeat your question?
We can't hear you, Adrian.
We'll come back to Mendo Voice. We'll go over to Sarah with KZYX, and then we'll come back to Mendo Voice.
About some details OptumServe. I'm wondering how often, can you hear me?
Yes.
Yes.
Okay, can you hear me?
Yes.
Okay. I'd like to hear some more details about OptumServe. I'm wondering how often we should get tested, especially if we're essential workers, and if there's a limit to how many times an individual can get tested for free, and what happens if we don't get enough people getting tested? Does that undo the opening we've already done, or just prevent us from moving into the next phase?
Yeah, I can start out by answering that question. First of all, I should have mentioned earlier that we have had another avenue for testing, surveillance testing with UCSF. And this has been, when I mentioned that some of the surveillance testing is OptumServe and some is from another source, that's been UCSF. So UCSF has been providing a program where for the entire state of California, they can do surveillance testing for free. And that program that we had for Mendocino County was through the Sonoma Lab, the Sonoma Public Health Lab, and that contract or that arrangement ended yesterday. So at this time, the only option we have actively in place for surveillance testing, other than that the clinics and hospitals could do surveillance testing themselves in whatever way they did organize. I mean, there's other ways to do surveillance testing. So I don't want to say that this is the only way that any organization could do surveillance testing, but the only way that the county can do it at this time is through OptumServe. That's how the county can lead surveillance testing, because the UCSF program is not available to us at this time. So with OptumServe, it is a use it or lose it resource. If we do not do the number of tests that are required by OptumServe, which is the 132 tests a day, we will lose that resource. And they're monitoring us. In fact, we got an email saying, you know, these are the numbers that you have, and you need to make sure you meet this baseline of 132. So we will lose it if we don't meet the numbers, but I'm very pleased to say that this week we are meeting the numbers. And I'm very grateful to our team for that. Regarding frequency of testing, there are guidelines for first responders and for skilled nursing facilities and for assisted livings. The guidelines aren't strict for assisted livings, but they're for skilled nursing facilities. For example, from the state, skilled nursing facilities have to have surveillance testing for 25% of their staff every week. So 100% of their staff every month from the skilled nursing facilities must be tested. That's a requirement from the state. Different employers, different healthcare systems could develop their own guidances for their healthcare workers or their first responders. The skilled nursing facility is the one that comes from the state. We offer our surveillance testing to our first responders and to any of the first responders, so that they can do frequent surveillance testing, and I would suggest that that would be every 2 weeks to 4 weeks would be the right frequency for first responders, frontline workers, because we know that there's about a 2-week, a period of incubation and illness that can occur with COVID. So more frequently than 2 weeks would be too much. And if someone is in a high-risk job, I think once every 4 weeks would be a good amount of time. For the general individual who lives in the community, who doesn't have high-risk contacts, who's not in a public-facing job, I would think that being tested with some periodicity would be a good idea. There's not a strict guideline for that, but there is not a limitation on individuals going back and being tested. So if I just had to say it off the top of my head, I'd say once every 8 weeks would be a good amount of time if you're out in the public and you're out and about to go through and have another surveillance test. Does that answer your question, Sarah?
Yeah, I just was hoping I hadn't used up my only opportunity to get tested yesterday.
No, you can go get tested again.
Okay. My second question
And thank
is
you.
about.
Thank you for getting tested.
It was not painless, but it was worth it.
It was quick.
Yeah. So my next question is about the rate of reopening. We've had political demonstrations opened up and they're okay now, but there are a lot of other ways that people engage politically. And I'm wondering when meetings like this and local government meetings will be open to in-person attendance again. I've noticed that public comment has dropped off pretty significantly, and with the Brown Act being loosened, I think there's some concerns that it's just such a huge hassle to do things virtually that people are losing a lot of the sense of engagement with their political process. And I'm wondering when that will be okay to happen in person again.
Well, I'd like to start out with an answer and then have Carmel Angelo give her thoughts as well. The governor has still banned all gatherings except for protests and worship and funerals. So in as much as it would be a gathering, it wouldn't be the right time yet. But your point is very well taken, that public comment is essential to a democracy. So I wonder, Carmel, if you have thoughts about when we might be opening up. I think the question is when we might be opening up for public participation in person. I think Sarah, you're talking about board meetings.
Board meetings and city council meetings and planning commission, just all the local decisions that are made that people like to weigh in on and share their piece in person at the meetings.
Sarah, this is Carmel Angelo. I cannot speak for any of our 4 cities or any other government entity, but I can speak for Mendocino County. Mendocino County will continue for the month of June to hold our meetings virtually like we've been doing. So that is approximately 3 more board meetings, maybe more than that, and certainly the Planning Commission and any other of our advisory boards or committees. We will reevaluate this toward the end of June. What we're looking at is utilizing the same method and under the direction of our health officer that as the county reopens and continues to reopen, we are also monitoring what happens in the county. So if we have a tremendous spike, we're experiencing some uncontained spread, community spread, then it may be that we go another month before we open up for our meetings. However, right now, we have only made the decision that through June, all of our meetings will remain online and virtual. And I know you've been following this, so it is a procedure in order to give public comment for our meetings. Additionally, we are hopeful that we will continue incrementally to reopen the county. Now, the county offices, effective June 1st, the county offices individually under their department heads and the elected department heads made their own decision as to whether they were going to fully reopen or not. And we have our 24/7 services and our 24/7 facilities, emergency services, of course, they have all continued through this COVID experience. But most of the other offices are still by appointment only, rather than just walk-ins. And of course, the reason for that is we need to protect our staff and we need to protect the members of the public that come into our offices. So if the doors were open and people could walk in at any time without appointments, it's possible in some of our front areas we would not be able to socially distance. We are still masking, we are still socially distancing, none of that has changed. Proper hand washing, everything that we've been doing over the last couple months. So that's where we are. And I would like to give you more information, but everything is a day at a time. And if we continue, as Dr. Doohan has discussed, 33 cases, we don't see any major spikes, then our hope is that we will, over the next few weeks, be able to reopen. One of the things that has come out of this is that we have learned that we could work with 2 different teams. So if you have 12 people in a department, you have 6 people Monday, Tuesday, Wednesday, and you have another 6 people Thursday, Friday. The goal there is that if one person gets sick, you still have another team that could come in and provide county services. Additionally, we've learned that there are some departments that really can work with their staff working remotely from home. So there have been some lessons that we've learned through this and maybe some long-term changes that we will make. The goal, though, is that we have been here to serve the public and we will continue to be here to serve the public. Thank you.
All right, thanks a lot.
Thank you, Sarah. So we're going to go back to Mendo Voice. Adrian, can you hear us?
Yes, can you hear me now?
We sure can. Go forward with your questions.
Okay, I'm sorry. I apologize for that. My internet's not great. So I'm wondering, Dr. Doohan, if you could talk about what the rate of infection looks like right now, how flat or spiky is the curve, and to what extent is there research coming in right now about changes in rate of transmission with the summer weather, whether that's affecting things the way it does with seasonal cold and flu?
So there has been speculation that there might be lower rates of transmission in the summer, but we don't know yet because we're still early in our reopening. I think a lot of us, the health officers across California, looked at Memorial Day and thought that was going to lead to a surge, and we're still 14 days within. Aren't we still within 14 days of Memorial Day? I'm trying to remember. Yeah, we're within 14 days. So I think we don't know yet, but there is a concept that I've seen shared. It's a nice graphic where it talks about the 3 C's. I think this came out of Japan. The 3 C's of COVID, where you want to let's see what it is: containment, crowding, and close contact. Those are the 3 C's. The idea being that if you're in a tightly contained area where it's crowded and you have a lot of close contact, there's more likely transmission. And we talk about transmission, this number called R naught, which is capital R little 0. So if you're in a crowded place, like imagine an elevator where there's no ventilation, everyone's close touching, and it's contained, there's going to be higher rates of transmission, which is the R naught, than if you were outside. So I think the idea being that when you get warmer temperatures, people are outside in the fresh air, they're not so crowded, you'll have your lower rates of transmission. In other words, the number of people one person infects will go down. So I believe that all the health officers thinks that will be true. And this is that there'll be lower transmission rates when people are getting outside. And for that reason, you'll see in my health officer orders that I released the last round, we had outdoor activities being opened up because the theory is that as people are outside, there's just lower risk. So I recorded a video with Sarah Duquette and our team a couple days ago where I was outside. I didn't wear my facial covering. We were more than 6 feet away. I wore my facial covering up to the moment we started filming, but that's very safe. There was a fresh breeze. We were outside, we weren't crowded, there was no contained area, and we didn't touch. So I think that is the best answer I can give you in terms of lower transmission in the summer. We don't think, there's no evidence that this infection can't live in warm weather or anything like that. I think it's more about crowding. Regarding, yeah.
Let me just drill down on one thing real quick. In terms of the wearing, you said you weren't wearing a mask. Should people be wearing a mask on the sidewalk when they're walking in Ukiah or Willits or Fort Bragg?
Yes, because this was a very controlled situation. I was standing more than 6 feet away. We were outside. There was no one around us. We were in front of the admin building. The reason you need to wear a facial covering in public, and there is a facial covering in public order, is that if you're walking down the street, you don't know if you're going to come into close contact with someone as they walk around a corner and bump into you. And so you can't control that you would be 6 feet away. We were in a very controlled environment, which is the only reason why I did it. Just like we're in a very controlled environment here. We're more than 6 feet away. It's a big room. There's no crowding. But out in public, you can't control who might bump into you. Now, if you're on your private land, walking down a road, you don't need to wear a facial covering because you can control that environment. You know you're not going to bump into anyone unexpectedly. I think there was another part of your question, Adrian, which was about how we're doing with our number of cases. Was that what it was?
Yeah. I mean, it seems like the rate, it seems like there was a little bit of a spike. Things basically doubled quickly, and then it seems to have trailed off.
Yeah, well, this is one of the reasons I'm so proud of us, Mendocino County. I mean, as I'm tracking this, we've had these clusters, and what we've done because of our strong team, and we've been doing case investigation, contact tracing. We just had a whole team go through that training last week through UCSF, and our communicable diseases team does a fantastic job. We wrap our arms around every time we have a case. We have an intense amount of activity that occurs in our team around those cases and doing the case investigation, contact tracing, making sure everyone's getting tested, making sure they're in isolation quarantine, making sure they know about the isolation quarantine blanket orders. They're ordered into isolation and quarantine. Because of that, we've been containing all these cases. And if we hadn't done this activity, these cases, no question, they would have led to many, many more cases because we're able to identify them early and get them into isolation quarantine. So this is why in our testing, the priorities remain containment and case investigation, contact tracing is top priority around testing, as well as our healthcare partners having facilities where they can test people who come in or sick. This is a top priority, and for this reason, through our MOAC, we gave 400 sample collection kits to our hospitals and clinic partners so they have enough resources so they can do the testing in their facilities. These are the highest priority, and as well as using OptumServe for surveillance and making sure that we can ramp that up so that we can offer surveillance to our outlying areas of our county through this second lane that we've talked about, which we can only put in place when we've met this baseline of 132 tests a day in Ukiah Valley.
And last quick question, will you be adding racial data to the demographic data on the dashboard?
We do have racial data. Oh, we're working on it. Thank you, Sarah. We are, absolutely yes. And the guidelines for that is very important, absolutely important. We know in the state of California that Latinx communities are disproportionately affected by COVID, and we know that has to do with disparities around, many, many things, but including, housing and people being in crowded homes and also access to testing and so on. But we want the data that we're going to post, we always keep privacy at utmost in all of our activities. So we want public health to be a trusted partner for all of our members of our community. For this reason, we don't drill down into the racial demographics, because if we did drill down too far, we might be able to identify who it is who has COVID. So there'll be broad categories.
Okay, thank you very much, Doctor.
You're welcome.
Thank you, Adrian. Next up, we have El Punto with Jacqueline Orozco, and we have George on the line for translation.
Thank you so much, Sarah and Dr. Doohan, for having Periódico El Punto in this conference. Mi primera pregunta es, debido a la falta de transporte o a las largas jornadas de trabajo, algunas personas que viven en áreas rurales se les dificulta venir a Ukiah para hacerse el examen de COVID-19. Está planeando el condado más eventos para ir a esas áreas para hacer los test de COVID-19? ¿Y se han contemplado algunos de los negocios esenciales como viñedos o lugares donde hay trabajadores agrícolas para ir a hacer los tests para que los trabajadores no tengan que hacer una cita y venir hasta Ukiah para hacerse el test?
Yeah, okay. There are people that they live far away from Ukiah. They don't have transportation. The county has considered the option to bring testing services over rural areas and people hard to reach out. Likewise, is there any policy to screen essential workers like agriculture workers or vineyards?
George, what was the last question? Is there a policy, did you say?
Yes, the policy or any procedure to screen essential workers like agriculture workers or vineyards.
Yeah.
Yeah. Are you planning to do some events in order to test those workers who works on the fields or in wineries or essential places?
Yes. So this has been a priority for the surveillance testing that we have done up until this time. When we had the UCSF partnership through the Sonoma County Lab, this free testing resource was a valuable resource that we used in partnership with clinics. For example, in Anderson Valley, there was excellent surveillance testing that was done through the clinic there, and we appreciated that so much. We're in a transition now where the UCSF free testing program has, ended for us yesterday, and so we're shifting to this OptumServe resource. And what we want to do with that is when we meet the goal that we have for the Ukiah Valley, the number of tests we have to do daily, which is 132 tests a day in the Ukiah Valley, we'll be able to expand so that we can actually go out into the communities that are more outlying and collect samples there and bring them back to the OptumServe in the Ukiah Valley. And there's no question that the agricultural workers are a top priority for surveillance. But I want to reassure that we were doing the surveillance, we have done the surveillance, with most recently May 26th being our most recent date. So we have done surveillance all across our county, and we only found one county resident from all of that surveillance testing and one out-of-county resident. So there were 2 positives that came out of that, UCSF surveillance program. So I think we have a good picture right now that we don't have widespread disease across our county, but we need to continue to do the surveillance over time in the months to come. And this is a priority. And we're very grateful for the partners that we have, our clinic partners, for example, and our city partners to help us realize this goal in the coming weeks.
Ok. Bueno, nosotros en realidad en el condado sí estamos haciendo, saliendo de la ciudad de Ukiah. Además, se han establecido convenios con clínicas que están en Anderson Valley. En Covelo también hay la clínica, ellos también están haciendo los test del COVID-19. Sin embargo, una vez que nosotros completemos un número prudente aquí en la ciudad de Ukiah, actualmente se están procesando más o menos 132 muestras por día, pero una vez que ya aquí, digamos, saturemos el mercado, ya nosotros vamos a poder salir con mayor frecuencia a las áreas rurales para también ampliar estos servicios en ellos. Por ejemplo, este mayo 26 se hizo un pequeño descarte epidemiológico en un lugar rural y se encontraron 2 positivos en ese lugar. O sea, sí, estamos trabajando, estamos considerando a la población rural y también tratando de satisfacer las necesidades en todo Mendocino, en todo el condado de Mendocino.
Ajá. pero se están planeando, sí se están planeando hacer en un futuro cercano más test en estas áreas rurales.
Así es, incrementar la capacidad, digamos.
Sí, exactamente. Bueno, la siguiente pregunta es una pregunta por parte de nuestros lectores. Estamos acercándonos a una temporada donde la gente de la comunidad acostumbra a hacer sus ventas de segunda, sus yard sales en sus casas. Uno de nuestros lectores nos ha preguntado si es posible hacer estas yard sales siguiendo los protocolos como usar los protectores faciales, los cubrebocas y el distanciamiento social.
Mm-hmm. Okay. In summer season, as usual, we have a garage sale or yard sales. It is allowed to organize one following protocols of social distance and masking?
Yeah, thank you. That's a great question. Now, we in the county, one of the activities that I do spend quite a lot of time with county council is going over the orders and looking at questions that we get, such as this very good question about yard sales. These questions come through our call center and other means, and we answer them. They're up online. They're called FAQs, the answers that I put together with county council. And we have one there about yard sales. The answer is that if you use the same guidance that is for retail, use that guidance, and then you can apply that to yard sale, then you can have yard sales. So this would be, for example, you want to make sure that there's not crowding, that you want to be sure that people aren't trying on clothing, that there's good spacing and they're not touching common areas. But please do look for those FAQs on our county website, and there is one on yard sales.
Okay. Bueno, la respuesta es sí, siempre y cuando se guarden ciertas medidas de seguridad, el distanciamiento, usar la mascarilla. Más información podemos encontrar en la página web del condado, porque organizar una venta de garaje en el jardín es similar a lo que estaría pasando en supermarkets que venden también ropa. Entonces, podríamos nosotros implementar las mismas medidas de seguridad para poder garantizar de que no vamos a expandir más casos de este virus. Igualmente también que tenemos que tener cuidado con las áreas comunes que se tocan, ¿no? Porque puede venir un cliente, tocar un área y después el otro. Entonces, eso también hay que tenerlo en consideración al momento de querer organizar una venta de garaje.
Gracias, George. Gracias, doctora Doohan.
Thank you.
Thank you, everyone, for joining us today for the Friday COVID-19 update. We will see you again next week. Thank you.